Welcome back, everyone. So I'd like to invite Sandra, Dyer and Nikki MacFarlane up. They're coming to us to talk about the London Regional Cancer Community of Practice for primary care and community nurses and allied health professionals. Thank you.
Hi, so my name's Sandra Dyer. I'm primary care lead nurse at a team called Transforming Cancer Services Team for London. And I'm joined by my colleague Nikki down here, who will introduce herself properly when she comes on. And I'm going to be talking about our Pan-London Cancer Community of Practice. I just want to say thank you to Nate for the opportunity to speak today, and also to say that our Community of Practice is a collaboration across kind of three organisations really. So our team, TCST, Central London Community Health Academy, and NHS England, WTE, which is Workforce Training and Education, so previously HEE. A little bit of background to our Community of Practice. Now, this is a slide I suspect everybody's quite familiar with, but I kind of want to kind of cast your attention out of hospital and thinking about what the needs are for people living with and beyond cancer. In terms of the numbers of people growing, the growing number of people living with cancer, the complexity perhaps of their care needs as we see a growing ageing population. What services might we need in primary care and community settings to meet the needs of those people in the future? So to do that, I'm just going to look at the needs of the population on a primary care network basis. So thinking about 40,000 patients, how many people will be living with and beyond cancer, and on average that would be about 1,400. And you can see from this slide, I'm not going to read it all out, but you can see that there's, for some people, quite a lot of complexity. There's a wide range of needs. There's also to consider the social determinants of health and disparities. I know you've talked about, or you've heard a lot about those this morning. And to meet the needs of that population, we need a multi-professional workforce. And we need a skilled workforce that's competent and confident to look after and care for people living with cancer. Another slide and data, again, you're probably very familiar with, the National Cancer Patient Experience Survey. But again, I want you to think about out of hospital. What we know year on year is patient experience in terms of care that people receive in both primary care and community settings leaves a lot of room for improvement. I think the kind of key to kind of addressing that is to consider what support's available and how confident and competent the workforce is to provide that care. And this next slide just kind of illustrates that, and it's just one example. So it's from a piece of work that took place in South West London between 2018 and 2020, funded by Macmillan, when we were looking at the role of primary care nursing in relation to cancer. We conducted a training needs analysis for just general practice nurses, and just kind of cast your eyes at the headline. So we found out that 70% of respondents hadn't received any training specific to cancer. And those who had, it had been very sort of specific in relation to cervical screening. And I was both looking at their sort of undergraduate experience as well as postgraduate. So I think it's really shocking, and it shows us there's an awful lot of work to be done. So out of that project back in 2018, we sort of scoped and planned and delivered a short programme for primary care, mostly community nurses with a few general practice nurses, kind of looking at cancer care across the pathway. Successfully evaluated with some good outcomes. After a 4-day programme, nurses felt much more confident to have discussions with their patients about cancer. They didn't see themselves as experts, but where previously they might have avoided conversations with their cancer patients, actually they would engage in conversation and they'd have an idea about where to signpost kind of questions or where to signpost patients to. So after that successful evaluation, we had some more funding from what was HEE at the time to run that London-wide, and we did that between 2020 and 2023. And that programme kind of developed a little bit. It started off community nurses. We started to get general practice nurses interested in joining us as well, and we had a small number of community-based allied health professionals. Again, we demonstrated kind of increased confidence and competence through the evaluation, and our cancer community of practice has kind of really grown out of that piece of work. We saw the need to continue to provide an opportunity for ongoing education support and networking after the programme completed. And just an illustration really of where we think the touch points are for community and primary care nursing and cancer. And you can see from this, we believe that's kind of across the whole pathway, both in terms of kind of prevention, thinking about promoting cancer screening, early diagnosis, of maybe thinking about the role of general practice nurses who might be seeing patients with respiratory illness or chronic diseases such as COPD, opportunity to pick up different symptoms, so for early diagnosis of lung cancer, for example. And then moving on to kind of support during treatment, particularly community nurses will be seeing patients during treatment, perhaps caring for IV lines, perhaps providing wound care. And then in terms of kind of living with and beyond cancer, again, it's kind of seeing cancer as a long-term condition. And we know many people with cancer will have a long-term condition, so it might actually be well known to their general practice nurse within their primary care setting. And at the end of life care, district nurses clearly are kind of the kind of linchpin in terms of enabling people to kind of die in their preferred place of death if that happens to be home. And end of life care in terms of kind of shared decision making and advanced care planning, again sort of bread and butter work for community nursing. And when we're kind of describing community nursing and primary care nursing, we're kind of thinking about quite a large group of nurses. So that might be kind of adult community nurses, district nurses, those with kind of specialist practitioner qualifications, might be learning disability nurses in the community, mental health nurses, general practice nurses and advanced nurse practitioners. So it's a big group. We've actually had sort of representation from actually all those groups within our training package. So I'm going to hand over to Nikki now to talk a little bit more about our community of practice.
Hello everybody, I'm Nikki. I'm the lead nurse for enhanced supportive care at a hospital in South East London, but I also work as a cancer primary care cancer facilitator in Southwark, and that's how I got involved with the cancer community of practice. So the Cancer Community of Practice was launched in February 2023, so we've been going just over a year now, and it was developed as Sandra said, as an output from the community education programme that we were running, with the aim to bring together not just the nurses but the AHPs in primary and community care with more specialist cancer nurses and AHPs from secondary care to improve knowledge and develop practice and influence change. And we've had 10 events over the past financial year, so 6 of those were webinars and 4 in-person events. Our membership is multi-professional. We've got physios, speech and language therapists, both from the community and secondary care, and most important, we've got patient partner involvement as well. So this is just our logic model that we use to map out our activities into our short-term, medium-term, and long-term outcomes. And Sandra will come back to this in a later slide. But we've aligned our evaluation to these, and our short-term objectives, outcomes. We've mostly met within the first year, but we'll talk about that in a future slide. So collaboration. So one of the things that the community of practice is about collaborations, about bringing people together. And that's what our face-to-face sessions are so important. They enable members to work with others in their local systems. So we try and group people when they come to the face-to-face sessions in their geographical areas within London. We do occasionally have people from outside London, but it is generally a London-based community of practice. And we also have organisational collaborations, which is the key to the success and sustainability of the project. So one of the collaborations that we did. And I'm not going to tell you now what a World Cafe is, because I know that you all had a session before lunch around, it was based on a World Cafe model, but we did the same thing with one of our face-to-face meetings, and we were looking at quality improvement and trying to not just showcase quality improvement and showcase examples that the members of the community of practice had done, but to encourage and to inspire perhaps others to take on quality improvement projects or to replicate things that we had started. So this is just a quality improvement project that we did in Nexus in Southwark, which was looking at increasing the quality of the cancer care reviews by instead of taking quantity of a review, which we knew to be an unreliable indicator, we were looking at quality basically by using the Macmillan template and taking some codes from that to try and measure quality and see if we could improve the quality of the review. We also were training the nurses using the community of the Cancer in the Community programme to upskill them to be able to deliver those as well, which did show an increase in quality, which was very pleasing to see. Another thing that we've through the community of practice that we're trying to establish is around shadowing opportunities or interprofessional learning. So we know that there's limited communication between primary and secondary healthcare, and we know that that's a significant barrier to achieving good quality patient care. So we were looking at seeing if we could enable shadowing opportunities and interprofessional learning. So we're putting a small working group together to look at that, to see if we can do a scoping review of the literature that's already out there, and then perhaps come up with a toolkit, something that people can use to enable them to facilitate shadowing opportunities between the primary and secondary care, or secondary and primary care, either way. And this is just lastly from me, we've also collaborated with the genomics service, so the North Thames Genomics service. So we've done a joint webinar with them, and we've got a shared purpose, which is to improve patient care and experience, but also to improve the nurses and the AHP's knowledge and practice around these areas, so that we can all learn and collaborate across boundaries. And I will hand back to Sandra for the evaluation findings.
Thanks, Nikki. So thinking back to that logic model and our short-term objectives, I'm just going to show a few slides to show you how we think we've managed to tick off those boxes. So in terms of engagement, our groups were growing quite dramatically within 23-24. For our face-to-face events, we have between 30 and 40 community of practice members on average. For our webinars, we've had up to about 200 people register for a webinar, and about 119 has been our maximum actually on a call. We've now got 186 members, and as Nikki showed, we've got a range of job roles in both our membership and also our steering group. So you can see that from the sort of pie charts at the top there. So we've got a good geographical spread, we've got a good spread across primary, secondary and community, and a good spread in terms of different job roles, which is kind of what we were aiming at, so that's great. This is some feedback from a evaluation that we did using mixed methods survey that we do after each event. And you can see we've got average rating of 4.63 out of 5, which is good. And some really positive comments, particularly around sort of making changes to practice, taking stuff back to the workplace, wanting to do things differently is consistent themes. And I'll show you a little bit more about the thematic analysis in a sec. But also to note that the webinars are kind of co-produced and delivered by our community of practice members. So these are the themes that came out of the sort of qualitative comments on the forms. So we picked out 4 kind of main themes. The one is about supporting innovation. It's an example here about that opportunity to kind of work together in a system, and how that really sort of sparks innovation and ideas that people can then take forward. that the sessions are interactive and safe, and people feel able to speak up without some of the sort of scariness of public speaking. So again, it's that sort of small table, small group discussions which facilitate that. And in fact, on our tables, we have a sort of wide range of kind of experiences as well as different settings. So from kind of nurse consultants to senior managers to trainee nursing associates. So that works really well in terms of kind of learning and sort of role modelling as well, I think. And then another one is connecting professionals and building a community, which is kind of obviously key to a community of practice, that we want to build that community. So again, that kind of spark, seeing other people being kind of energetic and having ideas really kind of helps build that sense of kind of wanting to do things together. And then lastly, I think really crucially, changing practice. So changing kind of practice for oneself, as in improving your own practice, but also wanting to take things back to teams or organisations to make changes. And a couple of examples there on the quotes. So just going to take you back to the logic model. I'm not going to read it all out, but you can see I've put a little pink box around those short-term goals. So from the data I've showed you and from the evaluation, I think we can safely say we've met those goals, which is good. Obviously, we need to now be thinking about our sort of medium to long-term goals. And essentially what we want to do, our long-term goal, which is kind of when we developed the logic model and work backwards, was about improving patient experience and having visible nursing and HP workforce and clinical leadership in that workforce in primary care and community. So to conclude, as I said, we're aiming to move towards the medium-term goals now. To do that, I guess it's essentially, as a sort of starting point, we need to focus on sustainability in the context of a very uncertain funding environment in the NHS at the moment. So getting organisational buy-in and sort of senior system leaders to support the community of practice is really key. In fact, we had a really good event yesterday as our end of year one anniversary event, and we had those people in the room and some really good conversations around sustainability, which was really pleasing to see. So our plan for 24-25 is to deliver a series of events. Again, it's going to be a combination of webinars and face-to-face events. And the session yesterday helped us generate some really good ideas around that. And a really sort of kind of recurrent focus of discussions yesterday was around that interface between hospital and out of hospital, communication, discharge planning. How do we kind of really smooth out that journey for patients? So I'm sure we'll be taking that forward in our webinars and activity for next year. We want to create links with other communities of practice, so the Lead Cancer Nurse Forum, the Lymphedema Community of Practice as examples. And as Nikki mentioned, taking forward that idea around sort of shared learning across primary and community and secondary care through shadowing. And we see that as an opportunity for both the specialists and the non-specialists, kind of learning about each other's expertise and how those different settings work. And we'll also be kind of taking our ideas around various conferences. So we have submitted an abstract to MASK, the Multinational Association for Supportive Cancer Care, which is an international conference. Hope to some publications and looking for opportunities to collaborate with other regions where there's similar work taking place. So, any questions?
About the shadowing idea. I think it's amazing. Have you actually been able to implement that at all?
Do you want to say something, Nikki?
Oh, sorry. Yeah.
So we've loosely been able to, so the project that I did in Southwark was, I trained up, with the community, in Cancer and Community course, we trained up some nurses to deliver cancer care reviews. And with that was the opportunity to do some shadowing, which we'd set up with King's College. So there were two nurses who did go and do from primary care to secondary care. I suppose the work that we're looking at now is doing it both ways, and we're just starting with a scoping review of looking what there is out there, and then hoping from that we can develop a toolkit. But we've got a couple of hospitals certainly in the southeast who are interested in collaborating with us, and I suppose we're looking for other collaborations. So anybody that's interested, then yeah, we would love to hear from them.
It would be a great place to start an induction, even just
Absolutely,
just a day
yeah.
in, like, particularly if it's like a chemo unit or a SACS unit, just because there's so many people going out and having treatments in the communities. For someone that's working in primary care to be able to spend the day in one as part of their induction, I just think that'd be.
Yeah, definitely. And I think working
vice versa.
back,
Vice versa,
definitely
yeah,
working
yeah.
back the other way. I
Yeah,
think to have an
yeah.
appreciation, I didn't have an
Yeah.
appreciation of primary care, having worked for 20 years, always in secondary care, and then going into primary care. I had no idea how it was set up and the complexities of it. So I think it's a really good opportunity both ways.
Yeah.
So yeah, if anybody is interested in collaborating, then please do email Sandra or me. Plug there.
Brilliant. Oh.
Thank you so much. Thank you. So